Hello everyone. In this lecture we are going to see another topic, that is special education. So, what is special education? Special education refers to the education of persons who are gifted and those who have physical, mental, social or sensory impairment and cultural differences so as to require modifications of the school curriculum, programs and special services and physical facilities to develop them to their maximum capacity. So basically, special education is that approach to education where every aspect of education is special. All children in the schools have disabilities, either similar or multiple. The curriculum followed in special schools is very specially designed from the general education. The pedagogy used in the special schools is also special and the teachers are also called special teachers. The teacher-pupil ratio in class in a special school is very small in comparison to general school classrooms. We can better understand the concept of special education with the help of this picture. There are a general school and a special schools. In a general school, non-disabled children participate, whereas in a special schools, only disabled children can participate. So, in this system, disabled children get special curriculum and special facilities, but they feel inferior. Therefore, we can say that special education is the practice of educating students with special needs in a way that addresses their individual planned and systematically monitored arrangement to teaching procedure, adopted equipment and materials and accessible settings. Those interventions are designed to help learners with special needs achieve a higher level of success in school and their community than may be available if the student were only given access to a typical classroom education. Communication, special needs, common special needs include learning disabilities, communication disorders, emotional and behavioral disorders, physical disabilities, and developmental disabilities. Students with these kinds of special needs are likely to benefit from additional educational services such as different approaches to teaching, the use of technology, a specifically adopted teaching area, or a source room. After understanding the meaning and definition of special education, let's see few objectives of special education. Number 1, to provide appropriate related services to the children with disabilities according to their needs. Number 2, to facilitate the optimum development of innate potential of children with disabilities. Number 3, to provide equal opportunity, full participation and ensure protection of rights of children with disabilities. Number 4, to equip the children with disabilities with required skill and competencies for functioning as productive members of the society. And based on these objectives, let's proceed to understand the philosophical basis of special education. Every child with special needs has innate abilities to learn irrespective of one's particular disabilities. Special education shares with regular education basic responsibilities of the educational system to fulfill the right of the child to develop to his full potential. And special education has had inputs from both the charity model and the medical model approaches to disability. They also have a right to get appropriate intervention and education to cater to their special needs. Moving further with the purpose of special education. Special education is designed to ensure that students with disabilities are provided with an environment that allows them to be educated effectively. Disabilities that qualify for special education include physical disabilities such as deafness or blindness, mental abilities such as Down syndrome and autism, behavioral disabilities such as attention deficit hyperactivity disorder. In 1975, the Education for All Handicapped Children Act mandated that states provide a free and appropriate public education to all students, including those with physical, mental, or behavioral disabilities. The special education must include a comprehensive diagnosis by a multidisciplinary team and the development of an annual individualized education plan for each student, outlining academic and behavioral goals, services to be provided, and methods of evaluation. The students' parents must consent to initial screening and must be invited to participate in all phases of the process. In 1997, the Individual with Disabilities Education Act or IDEA expanded special education services by mandating that all children with disabilities, regardless of the type of severity of their disability, between the age of 3 and 21 years in the least restrictive environment. That is, children requiring special education must be educated with non-disabled children to the maximum extent possible in an appropriate program to meet their special needs. So, based on the objectives and purpose of special education that we have seen so far, the principle of special education are: first one is individual differences. In our classroom, some students are very different from most in ways that are specific regarding education, and special education is required to meet their educational needs. Second one is zero rejection. All children with disabilities must be provided a free and appropriate education. The school system does not have the option to accept or reject a child for education in a regular school. Third one is non-discriminatory evaluation. Students who need special education must be clearly identified to ensure that they receive appropriate SANDIs. Each student must receive a full individual examination before being placed in a special education program, with tests required at interval to assess his progress and difficulties in learning. Next one is individualized education program. Students with special needs require individualized education programs either in a resource room or a special class in the regular school. Such education must match with their current level of functioning and their special needs. Fifth one is least restrictive environment. As much as possible, children with handicaps must be educated with children who are not handicapped in the regular classroom. The regular classroom provided the least restrictive environment for handicapped children. Now moving further with the special education methods. There are specific methods and procedures in special education that enable the special educator to teach children with special education needs systematically. A gist of these is given herein in order of their implementation is: first, an assessment of the child's level in different areas of development and learning is undertaken. For example, in areas of cognitive development, language development, or skills. Second, based on the assessment report, an individualized education program is developed for each student that is used to guide work with the student. Third, regular education of the individual education program is undertaken to determine whether learning and development goals are being met and to check the students' progress. And next, all along, access and use of support services are facilitated so that special children has the desirable effect on the students. In this way, we have learned concept of special education. Thanks for listening to me.